Still with me, Azaria Tagaya on Ringgit Cents Plus. Now, in one of our previous episodes, we looked at how the no smoking rule at restaurants have helped some smokers save money by cutting down on the number of cigarettes they smoke. Now, if you're a smoker or are affected by secondhand smoke, pay attention to the next story. We spoke to two doctors from a private hospital about the two biggest illnesses that plague smokers: heart disease and lung cancer. How much will treatment at a private hospital cost? Will you be able to afford it without insurance? Now, we're going to start off by saying we're not here to discourage you from smoking, but if smoking is a choice you want to make, then you should be prepared for the consequences. We visited Sunway Medical Center and spoke to two doctors there that treat many smokers. Dr. Kao Ken Seong is an expert in respiratory medicine, and he sees smokers who come to him with late-stage lung cancer.
Late detection of lung cancer leading to delayed diagnosis and at one stage at which you diagnose lung cancer, the survival and or prognosis is actually very poor. All right, not many survive beyond 5 years, and I would say that despite recent advancement in the treatment of lung cancer, with targeted therapy, with immunotherapy, with improved chemotherapy, improved second-line chemotherapy. Although they have improved the progression-free survival, the overall survival is still dismal. At 5 years, you're looking at maybe between 20 to 25% overall survival.
Dr. Kao says many patients come to him with stage 3 and 4 lung cancer because they don't show any symptoms when the cancer is still at an early stage. So if you're a heavy smoker or exposed to a lot of secondhand smoke or have a family history of lung cancer, speak to your doctor about getting tested. He adds that once a patient is diagnosed with lung cancer, one of the first few questions that is asked is the cost of treatment. Newer treatments, like immunotherapy, which uses the body's own immune system to fight cancer, can be costly.
The cost of this new treatment can be beyond the reach of most average Malaysian. So you're talking about maybe between 50,000 to 100,000 annually for the treatment of advanced lung cancer if you're taking targeted therapy. If you're taking immunotherapy, you're talking about maybe $750,000 over a course of 2 years, right? And this is not including the costs that you would entail from the frequent clinic visits, the tests that one does. For instance, blood tests, radiological tests like CT scans and PET scans. They are not cheap either. So the financial implication is something that is quite obvious that most people would be thinking about the moment the diagnosis of advanced lung cancer is given to them.
Even if you do detect lung cancer early, the surgery cost to remove the tumor at a private hospital is expensive. Dr. Anand Sachit Anandan is a cardiothoracic surgeon and operates on patients with early-stage lung cancer, stage 1 and stage 2, which sometimes requires removal of parts of the lung, a lobectomy.
We take a typical case of someone coming in for elective lung cancer surgery and undergoes a lobectomy. In the absence of any major complication, again, you're looking at about a 5 to 7 day hospital stay and a total hospitalization cost maybe around 35 to 45,000 ringgit.
Dr. Anand adds that he also treats many smokers that require heart surgery.
Typically, in terms of costs, if we have an elective procedure, so most commonly we would perform a triple or quadruple bypass. But again, it depends very much on each individual patient, where the narrowings are, where the blockages are. But if we base it on, for example, a typical patient who has triple vessel disease and they need 3 or 4 bypass grafts, then an estimated cost could range anywhere from 50 to 70,000 ringgit. That would be the total hospitalization cost from admission till discharge, which is typically about a week's duration in hospital. And that includes approximately about 2 or 3 days in the ICU. And this would be in the absence of any major complication.
Patients who find that they do not have the right insurance coverage or the finances to pay for treatment at private hospitals have an added stress as they worry about where they will get the money for their treatment.
If there's an issue of someone who has insufficient insurance coverage or they are financially constrained, then part of our duty is to ensure that that patient is referred on to a public facility, a government hospital, university hospital, so they can get the necessary treatment. But we don't get involved in the financial planning per se. Our duty as clinicians is just to focus on the clinical, the medical aspects of the disease.
This is why critical illness insurance is so important, because the treatment cost at private hospitals is beyond what Malaysians can afford if they had to pay out of their own pocket.
Most major insurance company actually would cover treatment for all the critical illness that I mentioned earlier on that is related to cigarette smoking, with the caveat that some of this treatment may require certain information from the patient as well as their treating physician, which means that they have to write in earlier on and then they get approval from the insurance company before they can get their money reimbursed. So in certain situations, despite the fact that they may need the treatment quite urgently, these patients may have to actually pay out of pocket first and eventually submit their reports from their physicians and so on and get the approval of the insurance company. So it requires quite a fair bit of process there. Right? So it's not always that simple, all right? But to answer your question, yes, most of this treatment for the critical illness related to cigarette smoking are covered by insurance company.
The two doctors we spoke to says it's a personal choice if someone wants to continue smoking, but they discourage it as much as they can.
It's an individual choice, but there's no health benefits. And financially, as we know, it's also a very expensive habit as well. So sometimes any opportunity when we see a patient, we try to just advocate and gently counsel. Not preach, but just gently counsel them against the hazards and perils of smoking.
If you are going to continue smoking, get your affairs in order. Get critical illness insurance and life insurance to cover your family. Make sure your children also have medical insurance, as secondhand smoke is going to make them fall sick more often. You live with the choices you make, just to make sure you're prepared for its consequences.